Dr. Fox, this is a really tricky question.
Oh, I don't like those.
I know you haven't had time to think about it, but doesn't menopause cure endometriosis?
Well, there's some relative truth to that statement. What happens in menopause is the ovaries run out of eggs, so the ovaries quit making estrogen. If we look at medical treatment of endometriosis, all the treatments are directed at trying to lower estrogen, and some of them to zero. So the new Orlissa, which really is very much like the old Lupron. So we take a 25-year-old with pain, we put them on Lupron, their estrogen goes to zero, their pain gets better, but then they have menopausal symptoms and they feel terrible. So it's kind of a double-edged sword. So in the older literature, when we talked about endo, we said, well, when women go into menopause, it kind of goes away. The endo is not gone. It's just like it's being treated with zero estrogen. So the lesions sort of become less metabolically active, they shrink a little bit, they don't really cause pain so much. But if a woman goes through menopause and they take estrogen, now we're continuing to stimulate that lesion and the pain might persist in that situation.
So a woman in menopause still needs excision surgery for treatment of endometriosis.
Well, I would say if they're symptomatic. Endometriosis doesn't really cause cancer or a life-threatening problem. So if they're in menopause and they're not having pain, but we know they have endometriosis, I wouldn't necessarily say that they have to have surgery to have that out. If they're having pain or symptoms, then yes, maybe we address that. Another big feature in the menopausal age woman, though, really is adenomyosis, which is endometriosis in the muscle of the uterus, and we believe responsible for most of the period pain after about age 30. So if they're symptomatic at 50 when they're getting into menopause, it's probably more adenomyosis, and often hysterectomy is the treatment for that to get the uterus and the disease out.